So reliable energy is a big problem,
Yep.
and your solution is elegant. But you had one slide that said that there was no direct competition, but there are a lot of players out there focused on energy storage solutions. And I'm wondering what, if any, intellectual property do you have for your solution?
So we don't have any patents related to our solution. As you said, there's a variety of other groups and organizations that have been in the renewable energy market. We're hopeful that some of these secondary iterations, such as the disaster relief and the work we're doing with NASA on collaborating with this component, will lead to some intellectual property opportunities. And I think there's a lot of people doing incredibly wonderful work in the renewable energy space, but no one that's really been looking at it from an immediate primary surgical perspective, and that's really the problem that we're attempting to solve.
So your strategy is first to market.
Yes, first to market.
Have you had any safety issues with your lithium batteries?
We haven't. Continue to knock on wood. No, and the lithium phosphate batteries are incredibly safe with regard to their profile. They actually, even with punctures, don't light on fire like some other versions of lithium-ion batteries. And as I said, this one's actually cleared to be transported by air, meaning it's stable at very low and very high temperatures. So that's one of the reasons we chose this type of battery. There's been a lot of development and innovation over the last decade in renewable energy, especially with lithium batteries and the different types. And I think that we'll continue to be innovative and make sure that we're utilizing the safest battery on the market.
So at Mount Sinai, we have a sister hospital in the Jinja province of Uganda,
Yes.
which is it's a wonderful facility. But again, it's plagued by an unreliable power system in the country, and so they have made very good use of a solar array using a battery system much like yours. So I think that the idea and the value is extraordinary, and the environmental impact is a wonderful thing. That being said, you said you're the only company producing something like this, and it seems to me that there's hundreds, if not thousands, if not tens of thousands of companies making solar products which could be used in a similar capacity. I have a little portable one I'll bring with me camping that gives me 12 volts DC or 110 volts AC, and it comes in many different sizes, from like a small package to a large thing that can power a refrigerator. How am I going to keep those other, very large market forces from overwhelming your company?
Yeah, so I think one of the important distinctions that we really try to draw is what we're doing in the surgical sector. There's tons, as you mentioned, of solar energy companies and people providing portable solar powered devices. A lot of the solar that we've seen in low resource settings is either hospital-wide, which means it's incredibly expensive for hospitals to put in on that scale, or they're backup systems and not primary power systems. And the goal of ours is really to be an easily implementable, accessible in hours system that's designed specifically for operating room equipment, and that provides that extra level of safety for providers and patients. So it's really that niche market within surgery that we're trying to address initially.
So, so looking at your business model, still wrapping my head around the nonprofit part, but I'll get to that in a second. Is it one installation per operating room? And if the power goes down, you talked about the average outage is 103 minutes, but what if it's 300 minutes? How long can you power an operating room for, is my first question. And second, from a strictly business point of view, what is your margin? Is the purpose of the margin to support the mission of the larger children's organization? We get that. We have Sage's Ingenuity, which is there to support the nonprofit mission of Sage's. So tell us how this works per operating room and what your business model is to support your ultimate goals.
Sure. So it's one unit per one operating room. The backup time is approximately 8 hours. So if the power goes down, or even at night, they should be able to operate for an 8-hour period. The hospital system, the main power system, there is a plugged supply. So if by chance the solar panel gets damaged or the solar unit gets damaged, that can still act as a backup battery, much like a large power pack, so that you don't lose that backup within the operating room. So there's a built-in safety valve there. With regard to the structure of the company and our margins, so there's multiple companies around the world, like the Sage's Ingenuity One, Heineken, IKEA, Rolex are all entities that are owned by foundations with the intention to provide money back to a foundation. Our margin, we're already making a profit. We need to approximately sell 25 units per year in order to start having profit. So we've sold 68 already this year. So we're already profitable. Our margin is about 40% based on the current cost that we have described here, the 25,000. And yeah, the goal is to create a mechanism by which we, as an organization, as a charity, don't have to go out and fundraise through donors and other organizations, but can really create a self-sustaining entity where we're able to impact the areas that we work in through the innovations in our global hospital commercial entity.
Yep, my questions are that relate similar to Dr. Schweitzberg. You mentioned 37 million a year at your peak. That brings me to, like, how long is that sustainable? At what point do you saturate? Because you're not going to make 37 million a year forever. And then what is the life cycle of your technology? Is some of that based on it breaking down in a year, 2 years, 6 months?
I had a similar question. You know, you said you have a number of systems. How long is the longest you've had one out? And how many have ever required repair, maintenance, replacement parts? How do those costs eat into the initial price point that you're selling this at?
Sure.
What's the warranty?
So the battery is warranted to, the way that the lifespan is described is in cycles. So it's over 3,500 cycles. That's fully drained. That gets it to 9.5 years for the life cycle of the battery. If it's not fully drained, the expectation is that that could last longer. The individual components besides the battery are incredibly cost efficient. We try to source the solar panels locally as much as possible. And otherwise, there's really not much in terms of cables that would be expensive to replace. So we say that the life cycle for one of these systems is 10 years. With regard to the market, so absolutely, we don't anticipate to be a static company. We really try to strive for constant innovation. And so one of the ideas, obviously, would be to continue to innovate the system. And we'd like to see it used for dialysis centers. We'd like to see it used for ICU care. Solar baby is what one of our founders calls it. And so we really want to make the system applicable to more and more situations, especially in the conflict zone and disaster relief areas, which unfortunately is a market that will probably, exist for years to come. But I do think that we are striving to have new iterations of it, similar with the medical oxygen concentrators collaboration. That's a new way to use this innovative technology that opens up additional market potential for us. Did I address all the points?
Warranty. So it breaks down.
Yep.
Who's fixing it? Who's trained to fix it? Who's eating the cost of that?
So for 3 years, we provide a full warranty, including all of the panels and all of the pieces. We also offer biomedical engineering support, and we have a virtual warehouse, a full operating room in our warehouse in Dundee, Scotland, which is where we're based, and we have support that we're able to provide from there. We have a local team. Right now, they're based in Nairobi in Kenya, but as we expand, we anticipate having additional local teams who can provide both on-site and remote monitoring and maintenance. And then part of it will just be continuing to make sure that we're really working with the right companies as we're sourcing to ensure that our batteries and everything are really top of the line. We're really not trying to compromise quality at all.
You also mentioned Ministry of Health partnerships, which I guess in the U.S. is kind of equivalent to government funding. two questions. How many of your 68 installations were funded through that mechanism? And then what happens to your company when the government runs out of money or decides to focus on something else?
Yeah, so initially we've really focused on those public-private partnerships and individual organizations and NGOs. So Scottish Government, Johnson & Johnson, Emma Foundation, other groups that have organizational funding are where we've really been focusing, again, because we want to make sure that governments can actually access that price point that we've set. The governments of Uganda, Zimbabwe, Tanzania are three that we've worked with. And so our funders come from all over. We're currently talking with Ministry of Health in the Philippines to be able to provide the solar surgery system there. And I'm missing one part of
Yeah, what percent of your current installations were based on?
We're based on that funding.
Yes.
I think it's probably about 10%. It's not the majority, but it's a portion.
Thank you
Thank
so
you.
much. That's great.